Good evening, St. John Baptist Church, and welcome to our Ask the Experts. We're coming tonight to give you some updated information on the COVID-19 pandemic, where we are now. We're going to talk a little about our booster shots, our children getting vaccinated, ages 5 to 11, and what about those holiday plans? We're going to touch on gatherings for the holidays since we've entered the holiday season. So come on and join us tonight as we chat about our updates for COVID-19. I'm going to give some time for folks to come in the room. Our wonderful experts are ready to give you some valuable information. And if you have any questions, they are prepared to answer them as you type them in the comments section so that we can address your questions. So welcome, welcome, welcome. And thank you for joining us tonight. We are excited. We have come so far with the COVID pandemic. So it's not over yet. However, we are excited that we can get our children vaccinated since they've gone back to school. Mine has got the first shot, so I'm excited about that. And we're going to get some updates with the clinic. So come on in the room and get ready for this information. Say hello in the chat section so we know that you're there. Good evening, everyone. Going to give a few more minutes for folks to join. Good evening, good evening, good evening. Welcome as we give some updates to COVID-19. Tonight, we plan to touch on some issues and give some answers to some questions that have probably been in the back of your mind, or you've been in conversation with family about what are you going to do for Thanksgiving? What are you going to do for Christmas this year as you try to gather your family together? So you're going to get all those wonderful answers tonight. Hello, good evening, Miss Bonita. Thank you for joining us. Click like and click share so that others can see this broadcast as we give out this good information tonight. Good evening, everyone. Be sure to say hello in the chat section. As we go along tonight, if you have any questions, please be sure to type them in the chat section and our experts will answer your questions. We have 3 areas we want to touch on. Tonight, we're going to touch on our children vaccines for ages 5 to 11, us gathering for the holidays, and we're also going to talk a little about boosters. Good evening, Ms. Satu. How are you? Thank you for joining. Go ahead and click like and click share, and we're going to begin in 1 minute.
I love the frame for your graphics with the pretty fall leaves.
Yes.
Definitely has me thinking Thanksgiving and that I need to think about thawing out a turkey.
I am so excited for turkey season. I just don't know what to do.
And I finally got to St. John's Church after 2 years, live and in person.
Awesome. Awesome.
Mm-hmm.
All right, everyone. So I want to thank all of you for joining us tonight for our Ask the Experts workshop on where we are now with COVID. And so our experts, Dr. Rhea Cragen, who is a family physician, and Miss Kelly Kessler, who is a Howard County Health Department official, have come to share some updates on COVID-19. And so I want to thank all of you. I would like to ask that you click like and click share so that others can hear this information. And if you have any questions, please be sure to type them at any time in the comment section and they will answer your questions. So without delay, ladies, take it away.
Kelly, why don't you start us off?
Sure. I have to give everyone fair warning. I'm not a very good driver with my mouse on this computer. So if I seem lost for a minute, it's because I'm trying to find my mouse. So hello, everybody, and thank you so much for joining Dr. Cragen and I. And Lisa and Reverend Dr. Turner, as always, thank you so much to St. John Baptist community for all the amazing things that you're doing and for, continuing to invite us back for updates. I will be very honest and say that I truly, in my heart, believe that opening the doors to congregations like yours and providing opportunities for people to ask questions and to, just share information is what has made Howard County so much more successful in our COVID response. So I want to thank everybody for that very much. I'm not going to spend a whole lot of time on numbers because I think that that's not necessarily what we want to talk about this evening. And I know people have a lot of questions about the kids, and much like me, like, how am I going to navigate this holiday season and the conversations around, are we testing? Are we masking? What are we doing? Um, but I do want to focus a little bit on our local numbers. And unfortunately, the number that you see there of 268 of our community members, we're actually at 269 as of today, community members here in Howard County that we have lost due to COVID-19 right here at home. Um, and I know that this is something that has impacted not just all of us here in Howard County, but many of us who have, lost individuals or are, maybe recovering and living with long-term effects of COVID-19. And, so I really want to take a moment in the recognition and sort of honoring the space that we're coming to by saying we've been through a lot. And especially walking into the Thanksgiving season and the holiday season, um, I think it's something that we all should give ourselves the grace to be thankful that we are here and to honor and recognize the people that are no longer with us. One of the best ways we can do that is not to let our guard down. And I know we're tired. I know we're exhausted. um, but continuing to still practice the things that we can do. We are unfortunately seeing our positivity rate rise. We suspect that it will continue to do so, especially as people are going to be traveling more for the holiday season. And so, really taking all the precautions that we can do, it seems simple now, although annoying, making sure we have that mask on, making sure we are, distancing, making sure that we are using the tools that we have, testing, and really making sure that we're doing all that we have in our control to protect each other in this time. We're setting an example, not just here in, Maryland, but literally setting an example across the country for communities that have banded together and have really, rolled up their sleeves to make sure that we're reaching everyone and that we're making sure that there's vaccine and testing available for everyone. We have over 96% of our population that is 12 and up that has had at least one dose of a vaccine. And when you look at that based on our race and ethnicity, we continue to really be making sure that vaccine is distributed equitably. And you'll notice, like, information, and again, these numbers do change. The takeaway there is that you see the percentage of a population, we're really about the same or doing fairly equally among all of our racial and ethnic populations. And that is not by chance, that is very much by intent. And that is because we have been working diligently with groups like St. John Baptist, groups that are helping us reach out into communities that may have had hesitancy or may have had difficult time to obtain vaccine. And so, it shows that when we set our mind with intention to be inclusive and make sure everyone is reached, that the least of these are served, right? And to make sure we're really, really reaching everyone. And I'm very proud of that and proud of our community for that. You can also see in terms of the numbers, you'll notice that we're now at that 2% vaccinated with at least one dose. We have started vaccine, thankfully, for our 5 to 11-year-olds. So that's very exciting. I see Dr. Craigan's big smile there. Like, I know that has to make your heart very happy. And we are, again, really working quickly on it. I will say, and we're going to talk more about this, With our 5 to 11-year-olds, we're seeing much more hesitancy, though. And this is where we need you to help us spread accurate information and share accurate resources. And that is exactly why we are here tonight, to try to empower all of you in this continued um, work to make sure everybody is vaccinated. So I know this is something Dr. Cragen is especially passionate about. So I'm going to turn this over to you because I don't know about you, but I know for me, we have two big events coming up. One of which I'm hosting at my house because I'm sort of feel like I'm much more able to tell people, well, no, we're going to get tested, or no, we're going to wear masks. And another that is starting to really challenge me in my mind because it is not in my control. And I know that a lot of people won't want a mask, and there'll be a lot of people from a lot of places, and even as a professional in this field, I'm struggling with how to have those conversations with friends and family. So Dr. Cragen, what are your recommendations for all of us?
Well, I have personally started to move about the country. I went to a conference, two conferences. One was in Vegas, and the masking was definitely very iffy at best. Um, and knowing where you are, who's around you. So the key is when you're planning an event or you're traveling about to go see family or come back from family, um, that you are aware of what's going on around you. So if you have no idea about vaccination status, if you have no idea about whether the person next to you does or doesn't have COVID sitting in the seat in the airplane next to you, then you should have a mask on. And you should have a mask on that's at least, 2 layers of cloth or KN95. I tend to travel on the plane with an N95 mask, but that's my comfort level. When I'm indoors, like the grocery store, that kind of thing, I'm wearing a KN95. And plan for your event. Talk to your friends and family about whether they are or not vaccinated. I tend to go only to indoor settings where people are vaccinated. And talk to your family about planning the meals and things so that there is ventilation where you're going to be gathering. And ask your friends and family to get tested for COVID before they come to your event. Usually 3 days before would be great. I have a doctor friend who for Halloween was giving out COVID tests. She had gotten a stockpile and she's like, here, you get a test then, you get a test. But it was just a reminder to say testing is important because you can have asymptomatic COVID and you can pass it on to somebody who's going to get very sick. And it's important to not be the one who's planning the event that's going to take out a family member. It would be really, really helpful if you plan with everybody's health in mind. So the other thing is that you can seat in groups so that people in the same household can be sat together and they can get up and eat together. And it's much less likely to have cross-pollination where one family is giving something to another family. Anything else that you wanted to add, Kelly?
Well, one thing I would say, there are some tools that are available. So especially if you're traveling out of this area, I will say you mentioned you felt free to move about the country, so to speak, or you had started to move about the country. Um, we had an opportunity to travel outside of Maryland, and everything was perfect. Like, it was a free hotel stay and the event was free and it was going to be, and I was like, okay, it's lining up perfectly. And then I went and I checked with the CDC to look at transmission rates, and it was definitely in the red, and it was definitely, like, by the county we would have been going to, a far different situation than where we would be coming from. And we actually used that for us as a guideline as far as did we want to go, and if we did go, who would go based on our individual risk level. So there is a really there are a couple really good resources. In Howard County, we have our COVID dashboard. So we can look at where we are here in Howard County. In the state, we can look to see sort of where our neighboring jurisdictions are and how they're doing. However, if you're looking to travel outside of this area, there is something called the COVID-19 County Check Tool, and it's on the CDC website. And you can actually go to the state and then the county within the state to see what the transmission rates are. Something else that people have said often, because we're hearing more and more about people who are having breakthrough cases, or vaccinated people who are getting COVID. The more people that are vaccinated, honestly means that you're going to see higher rates of people who have actually gotten COVID, because majority of people are now vaccinated. Vaccine, and maybe you can talk about this a little bit, because I think this is an element of truth that a lot of people are confused about.
Mhm.
The vaccine was never intended, although it would have been wonderful, to completely make COVID go away. You'll never get it, and if you're exposed to it, it's always gonna like shield it off. What it really is expected to do, or intended to do, is so that if you do get it, you have less risk of dying, or severe illness reduces the severity of illness. So we are
Yes.
going to see more breakthrough cases. But I think one of the things I've taken away from that is when we travel, we also try to look at like what are the hospitalization rates and like the clinical side of it. So I don't know if you want to talk a little bit about that in terms of how people might use that information.
Yeah, but the vaccine primes your immune system so that if you get exposed to COVID, then you can fight it off. And it takes what can be a life threatening, serious, lifelong illness, and takes it down to the level of a cold. It makes it feel like, a cold or a flu. And that is so much better than having to live with COVID-19 for the rest of your life. Um, the the other thing I wanted to speak about in terms of testing, because I had mentioned it earlier, was that you can get them over the counter now. You can get them at like Sam's Club for like $14. You can get them at CVS for like $24. And so when I say talk to your family about getting tested, they have over the counter tests that you can take. And they usually, some of them are rapid. Those are the antigen tests. You have to do more than one of those if they give you immediate results. If you send it off and it comes back the next day, those are more the PCR tests. And they're a little more expensive sometimes, but a little more accurate. Anyway, yeah.
And I know, well, and I see this is actually from a while back now, but many of you, and I know you said you'd finally been able to make it back inside the worship space. You've probably noticed the big white bus outside in front of the church. So St. John Baptist has partnered with Centennial Medical Group and First Call Urgent Care, and are offering testing as well as vaccine on site. And when I say vaccine, you can also get your flu shot. So make
Yes.
sure you get the flu shot too, because that is very much still out there as well.
And I have gotten both. I got my most recent booster 2 days ago, on Tuesday at St. John's. So it was a very easy process. You register on your phone, and you're in, you're out. It's no big deal.
Yeah.
So I would recommend that. I'm going to drag my husband this weekend.
Yes. So, well, and I said, for Thanksgiving, we my parents are getting tested and my in-laws are getting tested, and we're gonna go. Me and the kids and my husband march ourselves down the street. Thankfully, it's like 2 miles from my house, so not difficult to do. But it is a very it's a gift to the community to be able to do that right here. And especially also for the people that live right in that area, to be able to walk right to that area. I would also note that there is on the Howard County government website, if you can just search Howard County COVID, and it'll come up in whatever browser you're using. We do list testing sites. So in addition to what is available through St. John, we also through the health department are offering booster, third dose, pediatric. We actually are separating our clinics, however. So we, for safety purposes and because we are doing very large quantities of vaccination, but I know at certain sites such as the St. John, you actually can come and get what you need. If you need your booster, you need your third
Yep.
dose, you need your pediatric. So all
And they
very
have
helpful.
everything. They have J&J, they have Moderna, they have Pfizer,
Yeah.
they have kid doses, they have everything. And
So-
flu.
And I know there was a question in the chat, and I think you might have touched on it. Ms. Benita asked about over-the-counter tests and how soon the results are received. I can speak to from the health department, we do have saliva-based testing through the Azova test kits. We also have now received some Binax test kits that we'll be working to get out into the community. And it does take a little bit of time to get those back because they are sent out. And so that does take a little bit of time. If you are, what I have found for many people is if they are going to be traveling and they have to show proof of a negative test result within a certain window of time, that sometimes those are more challenging to get unless because you can't mail it out and have it back in 72 hours. But a site like the bus and First Call will be able to, most oftentimes you'll be able to get that result back very quickly. So
that is correct. And the over-the-counters, they're different depending on which kind you get. But the antigen tests are really quick, but they do have a few false negatives. So they're the kind that people tend to test at their job, where they test every week, or they test twice a week, because testing often takes care of the false negatives. The PCR tests are more accurate. They're also more expensive, and they usually take a little longer to get the results back. There are some molecular tests over the counter. She mentioned the Binax now, and that's a PCR test. But the molecular tests over the counter, they have a little battery, and you can do it at home, and but they run them more along the lines of $50 as opposed to the other ones, which are cheaper, where you send them off. Okay.
So yeah, go ahead, Dr. Craig.
No, I was going to just say I wanted to talk about the Peds vaccines.
Yes. So before we talk about the Peds, I do want to just remind everybody before they're Peds, they're growing. And so we do recommend that the vaccine, it is strongly recommended for women who are pregnant or breastfeeding to be vaccinated. And I know in our last session, we talked about that specifically, but that is something, I would be remiss if I didn't mention that again, because
at every stage of pregnancy,
exactly
before you get pregnant, while you're pregnant, first trimester, second trimester, third trimester, pregnant women don't do well with the disease of COVID-19. They do well with the vaccination. And you can protect your child because the antibodies cross the placenta and they help the baby get immunity. We don't have vaccines for infants yet. There is no way to vaccinate your infant. However, if you are a mom and you got vaccinated, then you are protecting your young one. And if you are a mom and you are breastfeeding, then your antibodies go through your breast milk and help to protect your child. So those
very
are
important. Yeah. And I know, like I said, I
can...
know we did talk about it in our last session, but one of the other things I want to remind folks about is, I would say one and done was true with J&J, but they are very much recommending if it's been more than 2 months that you obtain a booster. And many folks are talking that many are recommending that you actually obtain one that would be one of the mRNA vaccines, or you get another dose of the J&J. So you are able to mix and match. Ideally, it's better to get the same vaccine that you had, but with Johnson and Johnson especially, they are finding some interesting protective levels with the mRNA vaccine as well. But I know that one of the big things that people have to remember, or are often trying to remember, is where the heck did I put my vaccine card? And so I did want to mention for folks that you can actually pull up your vaccination record if you can't find that little white card or you need written documentation. I actually just had to do this. My child is an athlete in the school system, and athletes are required to be vaccinated. So I needed to be able to put that proof of documentation of his vaccine in there, so you can actually download that. But I also would throw out to everyone, that if you have children who, unfortunately, because of COVID, there are many kids who missed their regular well child visits and may be off schedule for their vaccine schedule and series. So what's really wonderful about visiting this myir.net is you can see where your child's records are and what vaccines they've had, and it will actually tell you that they're past due for certain things. We definitely recommend that if you have, your child is past due for vaccine, that we want you to, continue with that. We are doing some catch-up vaccination through the health department, but I know Dr. Cragen, many of the pediatric practices are just waiting. They want you to come back and they want to do those well child visits and get those kids covered through that. So I wanted to mention that as well and encourage people to do that.
So I wanted to mention a little bit more about mixing and matching.
Sure.
You can do your COVID shot along with your flu shot. You can do your COVID shot along with other vaccinations. So you don't have to worry that it's going to be a problem with your child doing multiple vaccines at once. And definitely give your child the flu shot as well as the COVID shot, because we are seeing higher numbers of flu and COVID rising as we head into the cooler months in the north and the west of our country, where people are starting to be inside more. We're seeing surges. And so protect yourself before things get a little further into the fall and winter. The mixing and matching of the COVID vaccines, with J&J, the studies show that Moderna is the best one to do a booster with, because of the mix of the Moderna has the great antibody immunity and the J&J has good cellular immunity. And for people who have done Pfizer and Moderna as their primary vaccination, either they can stick with the mRNA, or if they want to add some cellular immunity, they can do a J&J shot. But mixing and matching tends to do better than just staying with one shot. Okay.
So
Yeah.
yes, so moving on to now we're moving on to the 5 to 11-year-olds, and I can tell by your smile how how
I'm
happy
so
it
excited.
makes you. I know from the perspective of, if we all rewound, and I don't want to do it for real, but if we rewound to about this time last year, we were getting ready to ramp up, and many of you remember I very, very I don't know, if I can't even describe what the feelings that it evokes when I think about where we were last year and what it was like at first when the vaccine became available. It really was in such limited doses, and it was very, there were a lot of challenges in terms of, who and how and where. Right now, through the health department, we have received a limited allocation, but when I say limited, our limited now compared to our limited last January, very different limited. We're not having lines outside of buildings and things of that nature.
Mhm.
What's very exciting is that many of the local pharmacies are receiving vaccine already, and many of
Mhm.
the pediatric practices in our area are receiving vaccine as well. So we are expecting that sort of, I don't want to say the floodgates, but we are expecting that it will very quickly be very readily available, just as it has now become for, the adult or the 12 and up
Yeah.
doses.
With every week that goes by, it's much, much better. The first
Much,
week
much better.
was a little difficult to get an appointment or find who actually had it. But from what I'm hearing now, people are able to make appointments at their CVS, their Walgreens, their public health department, their pediatrician's office. And if your pediatrician um, says that they don't have it immediately available, um, then check some of your other resources. The sooner you get your child vaccinated, the better, especially with the holidays coming up.
Right.
It
Right.
still takes 2 weeks after your second dose for you to be fully protected. And so you need to get the clock going.
Exactly. And we do, as clinics come up, we are listing them again on our website. We mentioned that St. John will be able to now offer the 5 to 11-year-old doses as well. So that's exciting. And I wanted to just speak a little bit about the clinics through the health department, because one of the things that I know has been really important is looking at making sure that kids who have, or children and families who have, sensory concerns or other needs, are that we're really approaching the vaccine process and vaccinating all of our kids and families with the highest level of respect, and making sure that everything is family centered. And so I think that most pediatric practices, and our through our health department and others, really looking at making sure that, we're doing what we can to make the process as, I don't know, non-threatening, as welcoming, and there's a lot that goes into that. It's very interesting to see, how different it is vaccinating. And I will say, in some cases, if you go to large clinics, you may have people vaccinating who are not necessarily used to vaccinating children. They may be much more experienced vaccinating older adults, or, general adult age populations. But from the health department, we have done a huge undertaking of, just competency trainings, and making sure that all of the nurses and all of our vaccinators have gone through very specific training. And I know all the pediatric practices that are doing it. This is what they do. And many families really feel a lot more comfortable going to those practices. So we're going to talk about some of the vaccine hesitancy in a minute, but just some ideas for folks in terms of um, how can you help children as they're getting vaccinated, and what can you do, and that can mean a lot of things. It can mean you as the parent giving advice to your adult child who has their own child now and is trying to figure out this whole parenting and what do I do with my kid
Mhm.
perspective. It might be you as the parent taking your child. um, we do like, if possible, for the person who brings the child, the caregiver, to stay with the child whenever possible. It many times is very reassuring. But that being said, it's also really important that you're calm yourself. If you are somebody that passes out every time you see a needle, you might not be the best person to bring your child.
Yes. If
Or
the parent or caregiver is calm, the child is calm.
and
And
really
over
they
30 years of doing this,
yeah.
they look to you, and if you're okay, they're okay.
They
So,
do. I always remember when my little ones would fall, and there's that weird moment where you sort of look at them and you're like, are they going to cry or are they not going to cry? And my response as a mom was always to clap and go, "Yay!" And like 90% of the time my kid would stand up and be like, "I'm not sure why we're happy, but I'm fine." And then the other 10%, they might have actually been hurt, and then we quickly attended to that. But it really is true. Like, they kind of pick up that energy from us. And so, where you can offer them an opportunity to kind of have some control in what seems to be, or may seem to be, them a situation that's not controlling, even asking them, like, which arm would you like it in? That's a simple choice that, but it's giving them some control over a situation. Letting them know it's okay to cry if you feel scared, and it's totally fine if you don't feel anything. Like, that's fine. It's fine either way. Just giving them that permission. And, communicating with them in an age appropriate way, but in an honest way, right? Because kids developmentally can be very literal. And so even, the word shot to some kid, it can be a very literal word and they're not sure how to take it. So, a quick poke versus a pinch versus saying it won't hurt. Well, yeah, it actually might hurt. It might hurt, but
Mhm.
it's going to be quick. And so being honest, but yet age appropriate as you do that. And so again, thinking about how can we, continue to make them calm, just some ideas or just some thoughts around like developmental. And Dr. Craig, and I know you could certainly add to this, in that preschoolers and little ones, they're not necessarily eligible at this point in time, but quite
Mhm.
often you're going to have a family that is coming where you may have the preschooler with the 5 to 11-year-old because the parent is bringing multiple. And I know at our clinics, one of our nurses was like, well, do we have to hold the kids for their vaccine? And we jokingly were like, well, no, but you're holding the baby that the mom brought with them while their other child is getting vaccinated. And there are resources and support to help make it an easier process. But preschoolers have difficult time understanding that, you know, pain is sometimes for good.
Well,
That
one of the
pain.
things that works really well is having the young children sit in parents' lap,
Mhm.
and that is really giving me a hug, and well, you just hug me, and we'll get this done.
Yeah, and to that point, I wanted to share, and we can go back to some other things. Like, generally, the injection is sort of in like the upper arm or even in that upper thigh area as like an alternative location. And so there's three different sort of positions that generally work. And so, when you come to our clinics, we really try to engage the parent or the caregiver, whoever's with the child, if it's possible, in helping with holding the child if the child needs that. Sometimes they just march right up. My next door neighbor, she she said he
Yeah.
just walked in, was like, "Bring it
The
on,"
other
sat down, got a shot, and he was good to go.
The
Like,
other thing is that the needle is really tiny. It's the tiniest needle I have ever seen for children, um, and even tinier than all the other injections that we give. It's super, super tiny, which is good. And it's not the same dose as the adult dose. It's less for children. The good thing about it being less is we have seen none, and when I say none, I mean none of the myocarditis that we saw in some of the adolescents. And this is the most studied vaccine that we have ever come out with, more than you've heard of measles and chickenpox and tetanus and all these other vaccines that we've done all our lives, but they haven't been studied in children to this extent that these vaccines have. So I felt completely comfortable with my children getting them, and I don't have a 5 to 11-year-old, but if I did, I would feel comfortable vaccinating them.
yeah, definitely. And so I do want to just jump back a minute, because we talked about sort of like the contagious energy, right, of the situation. And I think what we're finding is sometimes clinics are offered at times that are more, we're trying to offer them right now at times when the children are out of school, but often that means you might be like bringing them straight from school or straight from an activity. And so, things you can do to help make sure that it's more comfortable, make sure they have a snack, those types of things. But I think about the child sort of, and where it sometimes is perceived as like they're having a tantrum. Developmentally, children in that 5 to 11-year-old stage, like, even if they can understand pain more logically, because of like the fear of that, they do and can have kind of exaggerated reactions to that. So the child who is screaming in terror, those are all normal developmental responses. And as a parent, my mantra often in my house with two teenagers and an early 20-year-old is, their brains are not fully developed. Their brains are not fully developed. And I remind myself of that often. But if you, as a caregiver, can, remind yourself sometimes that, these are normal responses, and again, try to keep your calm and your composure, it really does help them in managing their feelings and where they are. And most people really do want to be helpful and involved in their child's care, but we really do want you to make sure that the person who's bringing them is somebody that can do that in the calmest and most effective way possible. Other things you can do, is kind of helping with distraction. So like bubbles, or I'm not usually the parent that's like, here, have the iPad, but maybe the iPad is a good distraction,
I
or
always
maybe
like to blow up gloves or, you know.
exactly. Somebody said walking around the clinic right now, it's kind of like being in a carnival, and apparently the health officer, a little secret about our health officer, is her favorite job right now is blowing the bubbles at the clinic. She's a pediatrician by trade. And so she just, she's loving that, and it people are really enjoying that. But all of
Can I
these things can help. Yeah, go ahead.
take a quick pause and answer the two questions in the chat?
Oh yeah,
Um,
definitely.
Opal Elliott and Cassandra Belton had the same question about their boosters for their Moderna vaccine. And they wanted to know, if they got them in April, can they get their booster now? The answer is yes, you can get your booster now.
Yeah.
6 months after your dose, you can get a booster.
So that's a great question. Thank you. Hadn't noticed them in there, so I appreciate you catching them. And we definitely would recommend that if it's been that, and again, if it's been more than 2 months and you had a Johnson and Johnson, you're eligible
Right.
for your booster. So a couple other things to note is just in terms of working with children. I think what's very interesting about the 5 to 11-year-old space, and maybe I'm drawing on it and as my experience as a parent, is I feel like you're really figuring your kid out a lot. I mean, I'm still figuring out my adult child, but I don't know that I ever will at this point. But with the 5 to 11-year-olds, not necessarily even knowing if you have, where they're maybe, have anxiety, or maybe they have, any kind of developmental challenges, being even identified as being, on the autism spectrum, other sensory needs. So we do in our clinic offer, we call it a quiet room, but it's definitely a space that is available for children who may have, or families that may have that extra need. And anybody who's ever been around kids knows that, like, once one raises their hand and says, "Can I go to the bathroom?" everybody has to go to the bathroom. Interestingly, the same thing happens with adults. When we would have the 15-minute waiting after the clinics, or after your first doses at our large clinics last winter, one adult would say, "Oh, can I use the bathroom out in the hall?" And then the next thing you know, like 5 more adults. So it's apparently contagious. But we know that with kids and crying, you hear one child crying or being upset, it's potentially going to, lead to additional. So we do try to make sure that we have that quiet space. But it's also really important for all of us. And, especially as providers, we are very intentional about this. But I think as community members, it's just a really good reminder to check our own beliefs, check our own biases, check our own attitudes about the way we're approaching or being assumptive. I know as a parent, there have been times when I've been like, oh, somebody needs to tell that child. Well, no, maybe that parent has actually done the best that they can with, a situation. So go ahead, Dr. Cragen.
I was just going to say, Disney just announced that you have to be vaccinated to go on a Disney cruise. So I'm just saying, you might want to get that appointment scheduled. Not that I'm a big fan of cruises right now. And just a reminder that COVID is not over. That we seem to be on about every 2 to 3 month cycle where we have a spike in cases. And right now, Europe and a variety of places in Europe and other places in the world are being hit with a new version of the Delta variant, and which is more contagious, doesn't seem to be more deadly, but it seems to spread easier, which, is always a bad thing.
That's the thing. Viruses are smart.
Right. And not as symptomatic, which means that you could be sitting next to someone who has COVID and you wouldn't know it. But anyway, I digress. Go ahead.
Well, but I mean, again, and that's true. I mean, I don't want this to be a negative statement, but I can't even say we're in it for the long haul anymore, folks. I really do believe, and I think that many of us are looking at this as at some point we're going to shift from the pandemic COVID to the endemic COVID, which is sort of what we live with in our lives when we look at the flu. It's not something that will ever completely go away, at least not maybe in our lifetimes. But we will learn how to live with it and to manage it. And, I think, in a short period of time, we will all be looking back. And when we go get our flu/slash COVID shot, and it's one beautiful shot and we don't have to do, we will be in a different place. We're not there yet. And so we're living through this period of history. And, what we can do is we can help everyone because we across the lifespan, we are all living through this period of history. And so if it means that as a parent, I just know simple tricks like, okay, there's a freeze spray that maybe will help my child not feel or be so scared, getting that vaccine. It's helpful to know that. I wouldn't necessarily know that. Who knew that there's a thing called a buzzy that's like a little vibrating ice pack that distracts the kid and numbs the spot. There are like that's a great tool I would want to have as a parent in general. We had what we called the Boo Boo Bear, which was a little stuffed animal that you stuck a little like reusable ice cube in. And so anytime one of my kids would get hurt, we had the Boo Boo Bear. It's along the same line. And, it definitely does help with some of those things. So if we can all in this time do something to make life a little easier for each
And
other.
things will get more manageable because they're coming out with tests that are multiple purposes. So in addition to having a COVID test, it also is a flu test, and it can be an RSV test. In most pediatric hospitals, they have a multi-purpose test. So a child comes in and the symptoms are all the same: cough, sniffle, a little fever. You don't know what it is. And so you can do a multi-purpose test to find out what it is, which is really, really helpful from a diagnostic purposes.
Well,
Um,
and true that to not, I mean, if there's a test that can tell us multiple things versus I have to do multiple tests, that will
Correct.
be a much easier experience for everyone involved, from the
And
patient
so
to the parent.
along your lines with with things moving towards endemic, where we're learning to live with it. This is going to be here next school year, and I would love to say it's not, but it is. It's going to be here next school year. The more people that get vaccinated, the the sooner you will be able to plan your family activities with a little less trepidation, and you won't have to worry about bad outcomes from just getting together.
Even just thinking about how far we've come, a year ago this time, many of us were kind of making that sad plan that, we're not going to have Thanksgiving with anybody. And this year we're not debating whether or not we're going to do it. We're debating how are we going to do it safely. That in and of itself is progress. The fact that I know I'm going to be with my parents this year for Thanksgiving, and we're going to test and mask, and but we've made that much progress, and that's, historical, quite honestly. Um One thing I do want to touch on, and I think as I mentioned this a little earlier, is that we are seeing, especially with this population, um, more hesitancy in terms of getting children vaccinated. And so, it's really important to try to correct some of the misinformation that's out there. And I think it's really important to note that new parents and parents of young kids are highly targeted by
Social
anti-vaccine
media.
groups. Yeah, social media, anti-vax groups on social media, anti-vax groups, in a variety of places. I have been in numerous discussions lately where, there's also the anti-maskers that are targeting. There is not, any significant research that shows that masking is detrimental to our children's health. Culturally, masking is something that has always been a first line of defense. When you go to do yard work or you're, doing work, we mask because we can protect ourselves. When we're, going and, allergies I mean, these are practices that have been tried and true for many years. It's not fun. I get it. No, people don't necessarily want to do it, but I did want to touch on the hesitancy because I used to use this analogy like when COVID was first coming out, of like the Apple update. Those of you that are Apple users, there's the class of people who fall in, or even the new Apple phones or iPhones or other technologies. There's the people that when it first comes out, they run right to it and they do it. They get it. It doesn't, I don't need to see it. I know I'm in line. I've got my new phone is on reserve. There are the people who are like, I'm going to wait and see a little bit. And then there are the people who are like, nope. My dad is totally the nope guy. He's got the old school flip phone. He doesn't text. He doesn't send pictures. He literally uses that phone to pick it up and have a conversation. You've got the others, like everyone else in our family who's like, no, I want the phone. And I think a lot of people are approaching vaccination that way in general, but there's a lot more people in that wait and see category. And there's actually a number of people that are in that nope category because they have been so intentionally targeted by certain groups who have spread misinformation. And so it is important for us to be diligent in talking about how we can do this and how protecting them helps protect others. It is going to make it to the point where, that's the way the masks will come off, is once we have, our children vaccinated and being able to do that. When you look at the school systems in the surrounding area, Howard County has done very well. And I think it is because we've had a very intentional masking, testing, contact tracing, sort of trifocal point. When you look at even neighboring jurisdictions, the number of kids that are out on any given day because
Sorry,
they've
I
been
need
in
to stop
quarantine.
you there because I keep getting emails that, there's another child at your child's school who has COVID.
Yeah, I think we've all got them. We definitely
every,
have all gotten them.
every
Um,
week.
yeah,
And, I'm like, okay, well, um, my child had a close exposure, and she didn't end up coming down with COVID because she wears her mask everywhere. But it was just a reminder to her that this is kind of serious, and you might not want to let your guard down. Yeah.
exactly. And and kids are kids.
Right.
Adults are adults. And so, you do see people, we become comfortable with the people we're around a lot. And so, that's a reminder for all of us that we need to remain vigilant in what we're
And I
doing.
want to dispel the myth that your relative, your family member, your good friend who you've known since elementary school can't give you COVID. They are the ones who are most
Most
likely
likely to.
to give you COVID because they're the ones that you're going to be around without your mask. And it's the people who you are closest to. Um, if you have somebody who is, out and about without masks in the world with other people, then they might bring COVID home to you. And it's really, really important to,
I
try
just
to.
worry so much about the little ones and the fear. I know when all this was first going on, my son at the time was 13, and his biggest fear in all of it was never about him. His fear was that he was going to kill his dad. I mean, honestly, that was his fear, was that he would get it and bring it home and my husband would get sick.
Mhm.
And, my husband has a lot of compromised immune system and things like
Mhm.
that. And that's such a weight to be on the heart of a 13-year-old or anybody, and that to me is that terrifying, like, get the
But that's
vaccine.
how I move through the world because I have multiple family members with immunocompromise, and I cannot be the weak link to bring that home to my family. And so um, making sure that I'm checking the risk level, making sure that I wear the right level of protection, that there's ventilation. It's not that I'm not out doing things. I went to my daughter's concert the other day, and but I had an N95 mask on while I was sitting next arm, shoulder to shoulder with another stranger. So it's about planning, and it's about managing in the world.
Making those choices. So a couple other quick things, and I know we're running up on time, but in thinking about concerns and reasons we've heard, I think we've touched on a lot of these. I know Dr. Craig, you did talk about, these have been tested and tested, and the number of people that have been testing. And, one of the things I've definitely heard people talking about is they're concerned about the long-term health effects of the vaccine. And, we're living this piece of history. So I do completely honor where people are coming from with that concern. What I would say, though, is that the majority of true adverse reactions to vaccines, historically, they've been shown within the first 2 months, and that's
Yep.
why they do the significant levels of testing and the trials that they do. Do
In
you want to talk about that?
addition, especially the mRNA vaccines, they are such fragile vaccines. That's why they had to be kept super cold when they were starting out. They don't last long, they degrade easily. And once they're inside your body with your 96 or above temperature, it's not going to stick around. The key is to deliver it so that it can get into a cell to start making a protein, and then the vaccine is gone. There is no vaccine in your body anymore after 24 to 48 hours. And the all that's left is the ability to make the spike protein that presents it to your immune system, and your immune system does the work. There is no more vaccine in you.
So
They've
for
done
parents,
studies. They've
go
done
ahead.
studies to make sure that there is not vaccine showing up in reproductive organs in our body, both in men and in women. And they have looked, and there is no vaccine there. However, if you get COVID-19, the disease, it does tend to affect fertility, decrease sperm count, and um, the with pregnant women who get COVID-19, they are at increased risk for miscarriage, as well as spending time in the ICU and possible death.
So
So,
for parents, one of the things, my kids are a little bit older and, wanted to understand better how it works. So the way I likened the mRNA vaccine to them or explained it to them was that it was sort of like Snapchat, right? It's a message, it's opened, you read it, you take what you need from it. It's gone.
and then
The
it's gone.
ripple effect of whatever that message said, however, does go on. And of course, I then turned it into a lecture about make sure you're careful about what you're Snapchatting. But you can go a lot of ways with that. But it's a great analogy for parents because I think kids think that way, and they're using it that way. So definitely something to keep in mind. I did see a question about, is the session being recorded? And yes, it is. And please share with others if there's been information that is helpful. Please share with others.
And one last thing I wanted to bring up,
Mhm.
they are going to be doing FDA is meeting about the Merck pill by the end of this month, and about the Moderna booster, and Moderna approval for kids. I'm sorry, not the Moderna booster, the Moderna approval for kids at November 30th. And so I expect that Moderna will be approved for kids. And uh, I expect that the Merck pill that you can take, it is 8 pills a day for 5 days. And it basically decreases the symptoms that you would have from COVID-19. The problem is that it's only effective in the first 5 days. So if you get symptoms, you have to go get tested and treated right away. It is not a prevention, it is only a treatment. The only thing that we can do to prevent you from possibly getting COVID and getting sick and ending up in the hospital is vaccination. The same thing for the Pfizer pill. That one, both of them have been very effective, along the lines of 80 to 89% for decreasing your symptoms if you get COVID. But again, it has to be within the first 5 days. That one is 6 tablets for 5 days.
And I know we also in Howard County, we also have access to the monoclonal antibody treatment. So again, we think about how much progress we've made as we're living this history. It feels like we just keep running through the hamster wheel. But I think when we pause and we think about like how much progress we've made in this, less than 24-month period, that's pretty amazing to be at a place where we now have these potential treatments. And I do want to mention that there are certain medications that are used for other things that you're seeing misinformation flying around the internet and flying around in the media around them. The medicines, the treatments that we've mentioned with the monoclonal antibody treatment, as well as these pills that are being researched, they are the ones that are really being researched and studied, not off book prescribed for things in the hope. It has always been a little confusing to me how many people who are very much anti-vaccine because they don't believe there's been enough research, but yet they're willing to take something that has not been shown to even be effective and has not been researched for that purpose. It's kind of a ironic to me, but we are making great progress in having additional pharmaceutical treatments that
Treatment.
will be there. But the best thing that any of us can do right now is prevent it, and we can prevent it by doing the non the practices like masking, like distancing, like ventilation, and doing the vaccine. Those are the biggest things we have in our ability right now. And I know, like I said, we are running up on time, but just thinking about, sort of in summary, the things you can do as you're talking to kids, as you're talking to the families of those kids, is making sure we're spreading correct information and that we're treating each other with grace in this period, and we continue to. And
Yes, social media is not where you should get your information,
you've
because
got us. I mean, I guess we're on social media right now, but we're good to give you research. You can reach out to us. Contact Lisa at St. John Baptist, and she'll hook you up with us.
but just wondering if there were any more questions before we wrap up. Um, if I think I had covered everything that I wanted to cover. Because the biggest question I've been getting lately is, can you mix and match the boosters? And the answer is yes. The kids have been doing very well with the shots. There have not been any major side effects with them, not in the studies that have been done over the last year with the children, and not in the, we're at millions of kids now who have had immunizations, and they are doing just fine. So.
Yeah, I mean, just anecdotally from, people that we have heard the kids seem to be, ready to go. Many of them are actually very excited about that. And I think they're so resilient physically and mentally in many ways that I think that they are doing fairly well. The typical types of things you would expect: the sore arm, maybe a little bit of malaise, maybe a headache, that type of thing. But beyond that, they're doing very well.
And we also like to give you a heads up about what's coming. So I expect that there will be boosters for children, just so that you know.
So when we come back again.
Right, we're just at the beginning, but I expect there will be boosters for children, just like any parent knows that, they have to go and get shots on a regular basis for their kids. When they're really, really young, they don't make great immunity. As they start getting to the 5 to 11 range, they're really ramping up. And by the time they become teenagers, they have the best immunity of their lives. And, so boosters for the, teenage years may not be as much of a thing, but for the younger kids and for the older adults greater than 65, there will probably be boosters.
Definitely. And that is great information. The last thing I just want to remind everybody, and I did talk about this, I think we've talked about it throughout, is this has been a lot. It has been a long 20 months. I actually, on my list of things that I'm thankful for as Thanksgiving approaches, I am extraordinarily thankful for some of the friendships and partnerships, just like, the co-presenter of a lifetime with Dr. Cragen. We've been doing this for almost a year now, right?
Almost a year.
and
Over a year.
Yeah, I mean, it's been a long time, and having partnerships with groups like this congregation, I think it's something to be very thankful for. But it does get hard. And I think we all go through those moments. And so, I just want to remind people that there are resources that are available, especially going into the holidays and the challenges that can bring. We have great resources here in the county, and we are, very much available through the health department, through county government, obviously through, the congregation. um, you know, People are not alone in this, and we are still in this together, and remain in it together. So with that, I don't know, Dr. Craig, if you have any sort of last thoughts that you'd like to share.
No, just um, move through the world carefully is all that I would say. You can, start doing more regular things. Just take your mask with you.
Yep. That's so much better than it was last year when we were muddled in. So yeah, and last year my daughter was Clara in the ballet at her dance studio, but it was all virtual. It was a video ballet. This year those ballet shoes will actually be on the stage, and there may be a cameo from yours truly, as well as the rest of our family somewhere. So it's so nice to be able to actually, whether I have a mask on or not, resume some normalcy and continue to feed our hearts and our souls the way we have been. So, Lisa, I don't know if you want to bring us out with a closing prayer for the night.
Sure, sure. I just want to thank everyone for attending, for your wonderful questions, and for our presenters for giving us some valuable information. We have partnered with them, and they have been very diligent in making sure that we have the upcoming numbers, that we have correct information, and that we are charged to go out and spread the correct information to our family and friends so that we can make sure that we can stay safe. So thank you, Dr. Cragen. Thank you, Kelly, for all of the information that you just keep pouring into us so that we are educated and very well-rounded when we go out to talk about this issue. Again, I want to just let everybody know that St. John is in the vaccination business now. And so we are excited to offer these services 6 days a week. And so the clinic here is open Tuesday through Friday from 11 to 6 and Saturdays from 9 to 4. And that includes flu shots, booster vaccinations, children's vaccinations, and testing. So we are excited to be a one-stop shop for everything concerning COVID. So thank you, everyone. And I'm going to pray us out for the evening and adjourn this gathering. God, we thank you for giving us the tools that we need to move forward in this space that you have created for us, Father God. We thank you for our facilitators, God. We thank you that they have the knowledge and the expertise to come and pour into your people, God. We are grateful for this season of gathering and holiday and family, Father God. We've gone so long being in our shell. So, Father God, I'm asking now that you pour out your anointing, God, Father God, that you keep our families safe as we begin to gather for the holidays. God, I'm asking that no one has challenges in their health, Father God, from gathering with their family. So God, protect us and keep us until we meet again. It is our prayer. Amen.
Amen.
Good night, everyone, and thank you for joining us.
Thank you, everybody. Night.